Hi, my name is Stephanie Nguyen, and we're going to be discussing how to teach students on the knowledge and administration of common pain medication administration. So if you're going to teach a class on common pain management, it's going to take quite a few hours. I said this would probably take about 8 hours for a lecture. Before the children come to class, they're going to want to read the chapters. It's 17 in the text. There's also a couple YouTube videos that they could watch prior to class just to have a base knowledge of the information. Once they come into class, you may want to perform a question and answer session just so you can get a good idea of what the students have learned on their own prior to the beginning of class. Videos and PowerPoints to keep the students interested is a good way to keep their interest. I know a lot of times just standing in front of the class and talking, it really causes the students to get bored, and the different types of learners, there's hands-on learners, there's visual learners, they kind of get lost in the process. When you do a lecture with the students, you may want to include PowerPoints and include your medication absorption, effectiveness, and excretion. You want to include the different routes. There's oral, there's intramuscular, there's IV. Make sure you include the different types of oral medications such as tablets, capsules, elixirs, powders, sublingual, the different IM injection sites, and the different ways to give a medication IV. There's YouTube videos that the students can also watch to make sure that they understand exactly where those IM injection sites are and the proper process for giving an IV medication. You want to, after discussing this and doing your lecture, take them to the skills lab and have the students do a return demonstration so that you're sure that they really understand those proper sites for the IM injection and the proper technique to give those pain medications. Make sure you include on the IV medications how to use a PCA. A good example would be to bring the piece of equipment into the room and just let them have a hands-on demonstration. I always feel like it's easier for students to understand the equipment if they can actually get their hands on it and play with it. In your PowerPoint lecture, you also want to include the rights of drug administration. Make sure you include the right patient, right drug, right dose, right route, right time. There's also a YouTube video that you can present to the students to make sure that they understand. This is very important with giving any type of medication. In chapter 19 of their pharmacology book, you can have them turn in and discuss the different types of pain medication, such as opioids, NSAIDs, narcotics, muscle relaxants. You want to discuss their different actions, the different uses, the adverse reactions, the contraindications. Make sure you discuss patient allergies, what to look for when you give a pain medication, what to assess after you give a pain medication. You want to make sure that they're assessing their pain scale, patient assessment period, just making sure that they're still breathing and their vital signs remain stable before and after giving pain medication. You want to make sure that they understand patient teaching, like how does the medication work? A lot of patients don't really have a good understanding of how the pain medication is going to work in their body. You need to make sure that the students understand that an oral tablet can take at least 30 minutes to kick in, so they don't want to wait until their pain is excruciating. You want to include prescription and non-prescription pain medications, such as morphine, Demerol, oxycodone, codeine, and Dilaudid, just to name a few. And then the non-prescription ones, such as Tylenol and aspirin, Motrin. Make sure a good way to introduce this to the students is to have patient scenarios set up, like prepare a worksheet for the students and have them evaluate which would be the most appropriate scenario for each patient, such as giving this patient with a headache oxycodone or giving them Tylenol or Motrin. And follow that with a question and answer period just to assess their level of understanding. You want to make sure when you're teaching the students to include their assessment, like I mentioned before, but in the assessment you want to have subjective and objective information such as the vital signs, the age, weight, the diagnosis, the condition. The allergies are big on giving pain medication. The laboratory values, you want to make sure that they're going to be able to excrete the pain medication and that you're not going to give something that's going to damage their liver any more than what it already is damaged. You want to assess their nursing diagnosis, such as a risk for injury and that kind of stuff. Make sure that you're educating these students on the proper diagnosis and when it's important to give and not give pain medication. You want to teach them about planning, such as goal setting, priorities, make sure that they understand why they're giving the pain medication and what they can expect to happen after giving pain medication, such as the evaluation. After going over all of the implications for pharmacology with the nursing process, you want to include another question and answer period. Make sure you ask questions that are specific to the nursing process to make sure that the students really understood the phases in the process of medication administration. You may want to ask questions such as which diagnostic tests should be evaluated prior to medication administration. Maybe what are some of the physical assessments that should be completed prior to medication administration. And what you should expect to see after medication administration, such as your reevaluation of your patient. Make sure that they understand the nursing process, such as the diagnosis, the goal, evaluation criteria, the nursing interventions, and the evaluations, which promote a therapeutic pain relieving effect. After you've completed all of these processes and completed your lecture and done your skills lab, and you've clearly identified your students' weaknesses and you've helped them with their knowledge and you've increased their knowledge of medication administration, you're going to want to administer a test going over all these areas. After the unit exam, I have a passing score of 70 of multiple choice questions, and I would do a test review. After the students take their test, you grade it and you see which students missed the most number of the same questions and bring the test back to the students and let the students see why they missed that question, because they need to have a good understanding of pain medication administration. They're going to be giving a lot of pain medication during their nursing careers, and they need to have a good knowledge and a good understanding of this subject. So, thank you.